Torticollis is the third most common congenital impairment to affect infants. While it may not always be painful, it can lead to a list of other challenges if left untreated. The good news is that this neck muscle challenge can be addressed through gentle and effective chiropractic adjustments. So let's talk torticollis in just a moment.
Welcome to this episode of Hometown Health, hosted by Dr. Dan of Turo Family Chiropractic.
The Latin definition of torticollis is twisted neck, and that's a pretty accurate description. When an infant has torticollis, the neck tends to twist to one side, resulting in a head tilt. In newborns, torticollis can happen due to positioning in the womb or after a difficult childbirth. This is especially common if there were interventions like forceps, vacuum extraction, or assisted delivery measures that put stress on the infant during the birth process. Signs of torticollis, other than a head tilt, can be very hard to notice in very young infants, including having a preference in turning from one side or the other, difficulty breastfeeding on one side, or noticeable frustration at not being able to completely turn the head. If not corrected, torticollis can lead to other challenges, including flattening of the skull, scoliosis, muscular imbalances, asymmetrical facial features, and impaired vision. Torticollis occurs when the neck muscles are tighter on one side than the other. This restricts head turn ability and can cause neck muscles to become very tight and resistant to stretching. This decrease in flexibility can create additional health challenges because of how important neck stability is in the developing spine and nerve system. That's why it's best to address the cause of torticollis and correct the challenge so that nothing impedes this growth and development. That leads us to the big question. What is causing the increase in muscle tension in the neck? In my experience, it is quite often a misalignment or motion restriction, what chiropractors call a subluxation, in the cervical spine. When a vertebra is out of place or not moving properly, the muscles around it can become irritated, tight, or inflamed. This causes them to become less flexible and tight, which is exactly the challenge that we see in torticollis. Now, the good news is that through specific chiropractic adjustments, small spines realign, pressure is removed from tense muscles, and movement is restored. A chiropractic adjustment is gentle and effective for children of all ages, and because they respond so quickly to care, the results are often amazing in just a handful of visits. That's exactly what Brittany saw when she brought her little one in for a spinal checkup. She had noticed that her daughter was favoring one side in a lot of activities, and her pediatrician had mentioned torticollis being the likely culprit. With just one adjustment, Brittany saw a noticeable difference in her daughter's ability to turn her head and continued to see improvements as the muscle tension decreased. How can you find out if chiropractic care can help with your child's torticollis? Schedule a spinal checkup. Making sure that your children have proper spinal alignment and motion as they grow can not only improve their health now, but also prevent other challenges in the future. I recommend scheduling a spinal checkup for you and your family. That way, you are sure everyone is functioning at their best. If you think that your infant may be showing signs of torticollis and are looking for a real solution, I'm happy to help you find the root of your problem and work with your little one to resolve the challenge. Join us for one of our upcoming community events, or you can connect with me directly about your specific health questions. And remember, I'm here to help you get healthy and stay healthy for life.
Thanks for watching Hometown Health with Dr. Dan. To find out if chiropractic care makes sense for you, visit TuroFamilyChiropractic.com.